Sickle cell disorder is an inherited condition arising from the combination of genes the sufferer receives from both parents. A structural change in the hemoglobin of a red blood cell, which is normally flexible and rounded, makes a carrier's own prone to become deformed and assume shapes of a sickle, hence the name sickle cell disorder. When red blood cells sickle, they become rigid and sticky, making it difficult to pass through small blood vessels. They also cause blockages that result to poor blood flow to many areas of the body.
Ignorance and apathy have allowed sickle cell disorder to spread its tentacles across the nation, into different regions and tribes of Nigeria. Various myths and misinformations have caused stigmatization of people with sickle cell anemia, disclaiming the possibility of their living a robust and productive life.
What you are about to watch is the story of a young girl. Sit back and relax.
It's so swollen. I've got something for you. Oh, thank you. I'm so kind. I'm sure you're alright. You don't look it so. So many things have happened to me. Only you alone. Things like what, no? What did you happen? Are you alright? You're crying. How long have you been crying? How many days now? I don't know. Why was I even born? No. You don't have to start. Oh no. What we've gone through this stage. What again? What happened? Stop now. Stop. Tell me now. What happened? Tell me. Charlie refused to marry me. Oh my God. Why? He said I have sickle cell anemia, that he will not marry me. Just 2 weeks ago. Then where all this while? He did not know. I just told him. Oh my goodness. So how have you been coping with work? What's been happening to you? He sacked me. Oh my goodness. Sacked you? Why? He said I have sickle cell. I'm always going to the hospital. Where was I? It's okay. Don't worry. That's not the end of life now. Someone else will come around. Oh, I get to marry you. Because you get married now. How about? Are you okay? Did you stressing yourself? Have you eaten anything today? I just for 2 days. For 2 days you've not eaten? Oh my God. Let me get you something to eat. It's okay, but stop crying first, okay? Stop crying. Just stop crying, please. Stop crying. I have to get you something to eat. What would you like to eat? You don't want to, you have to eat now, so you have strength now. You don't have to be stressing yourself, so you don't have any crisis. And you're alone.
The sickness that.
You're alone. You're feeling cold. Okay, let me cover you. Is it just cold? You're sharing go to the hospital. So just take it easy. Stop. I need a jacket. This was a jacket. Oh my bag. Sorry. Okay.
Stigmatization of sickle cell of people with sickle cell anemia in terms of selection of life partners.
I don't know about something. I know that. I know for you. I don't want to go into personal, but I know people who wanted to marry. Somebody is here, another person. Families where they just went to Korea and married. That's all this. And one Nigerian woman came back. She was SS. Brought her husband to do traditional wedding. When he was a seafood. So they just went back to America. So there's not enough of support for people's choices. Everybody wants to tell you what to do. And then there's one woman from the east. She wanted to marry a man. They made all the preparations. And then the father of the man checked the genotype. They went to check. Found that the woman was AS like his son. He stopped the wedding. So that woman told us from that date she's AA. She's decided to be AA. A lot of people think they know enough about sickle cells. Even pastors some are saying they are curing it, number one. Others are saying when they don't cure it, you can marry because you have a family. Give them the right to say it's against your human rights. If you have hypertension, you can marry another person with hypertension. Many of your children, of course, because inherited same with diabetes. So give them the right to see, without consulting those who are working in sickle cell they start. So every Nigerian has a
So what's the nature of your you want to see the doctor? What do you can't you met people here? You can see I'm looking for someone. No, I think no, please. You met people here now. No, please. Please. Come on, before I find what's the problem? Yes, I can see that. That's the problem. She's on egg. This is only first time she's having this guy. I don't have to make it
starting point. At the second level, where shortage of healthcare professionals may be affecting the care of people with sickle cell disease, would be in terms of providing care for them. Care starting again from advising patients who suffer from sickle cell disease on some precautionary measures that they can take. For instance, not unduly exposing themselves to extreme weather conditions, adopting appropriate lifestyles, not putting themselves under stress and so on. And then of course, taking some prophylactic medicines, that can boost their immunity and boost their hemoglobin levels. So healthcare professionals are in a position to provide information for even those who already have sickle cell disease. And then of course on the third level, healthcare professionals are also required to now provide treatment for sickle cell patients who are experiencing one form of crisis or the other. So you can see that there are different ways by which healthcare professionals can provide the information. So the shortage of healthcare professionals may impact definitely on the care for sickle cell patients. But we must not throw up our arms because we can't still make do with, by training members of the community, by providing information to members of the community, so that members of the community themselves can pass on the message. While we wait till we get more health professionals trained. But we don't need to wait until we have one physician to every 400 population as they have in the United States before we do something about sickle cell disease. We can immediately, because largely lots of health education or public information can help to prevent the disease, by letting people have information that can help them, so that they will not say that love is blind. So.
Thank you very much.
Thank you very much.
Okay, so what are you? She's 25.
The main challenge to this strategy for quality assurance is that the average Nigerian doesn't want to even make a complaint. Or they make a complaint, they want to make a complaint in a different way. You bring in a patient, this patient is almost dying, and you are not satisfied with the service, and there is a phone number you can call. You are refusing to call that number. Then you wait until some unpleasant incident happens, and then you start complaining. When you could have made a phone call much earlier, because the whole purpose of providing the Servicom numbers in the accident and emergency, in all the wards, and in the children's emergency, is so that any patient or relative of patient who is not satisfied with service can make that phone call, so that the Servicom unit can intervene to ensure that the quality of service is appropriate.
I'm 44 years old. I'm married, 2 kids. To the glory of God, I don't look like a sickler. You wouldn't know if I didn't test. Like I said, I still had a mild crisis last week. I think it's something that people can manage. They just need to know a bit more. As the literature comes out, as the research comes out, there's something to pick, something to learn. There's no better place to do that than being in touch with the genetic counselor, coming to the center, being part of a club, reading up articles, and then interacting.
Last question. How do you think quality of healthcare is aligned to quality of life?
Prof said something at the briefing. So when the sickler is in crisis, what you give the person painkiller. Now, if you talk to a medical person, they say if you have a cold must run its course. Yeah. We don't know, for example, whether sickle cell has a course to run. Do you understand what I'm saying? But yes, you must treat the pain, because the pain is really, really, really severe, excruciating pain. but certain other things have been known to ease or to make cut short cycle. In some cases, in extreme cases, there will be blood transfusion. Okay. In other cases, it might just be, and that's because there's a lot of high rate of breakdown of the cells. Now people say take plenty of fluids, eat the right foods that contain folic acid. Folic acid is particularly good. People have said hydroxyurea, a good supplement. I went on hydroxyurea when I was abroad, and they asked me to stop it. So that's why I said the research
is still ongoing.
It's still ongoing. Things work for some things don't work for some people.
As a person with sickle cell anemia, I am not genetically sick. People with sickle cell anemia are individuals like you. We need to be understood, we need love, we need compassion, and not stigmatization.
And as a prospective spouse, you need adequate information, education, and genetic counseling to make informed decisions. Do not discriminate against people living with sickle cell anemia. They deserve to live a normal life.
People living with sickle cell need our love, our support, and our encouragement. Do not discriminate. Do not stigmatize them.
As healthcare workers, we are to offer people living with sickle cell anemia prompt and compassionate care. This is likely to prolong their lives and make them live a happier life. Please, do not discriminate against people living with sickle cell anemia.
And in our advice to the government, there should be a national policy on sickle cell anemia, and more funding should be raised for research work and management of sickle cell anemia. Thank you.
Long care with compassion, prolonged life, support people with sickle cell anemia.